Ready.
All right, it is noon, so we will get this webinar started. Thank you for joining us today. This webinar is on Jessner peels, everything you need to know. It's going to be hosted by Bree Adcock, licensed medical esthetician, and Dr. James Beckman. So just let me introduce the two of the speakers right now. Bree is a trainer for TheraDerm. She has been in skincare as both a practitioner and a trainer for more than 10 years. So she brings a lot of knowledge to the table, a lot of practical knowledge. She's actually utilized these things in her practice. So that's kind of a cool thing. Then let me recognize Dr. James Beckman. He's the founder and CEO of TheraDerm. He is a board certified plastic and reconstructive surgeon, as well as being a biochemist, and he was recently recognized as a clinical associate professor for the University of Arkansas Medical Sciences in the dermatology department. So that's kind of a new area we're branching out into, and we're happy for him to have that designation. Then Darla. Darla is the general manager of TheraDerm. She keeps it running all day long, while at the same time she has a wholesale territory. She also has our esthetician accounts. She manages all of those, and she manages all of our UK accounts. So she kind of has a busy plate, but she handles that really well. So anyway, let's get rolling. Oh, I did want to say, if you have any questions, feel free to ask them anytime during the webinar. It's not distracting to the speaker at all. So you can ask it in the little Q&A section, or you can chat. So either way. So I'm going to let Bree have it, and she's going to pop up a PowerPoint for you guys to look at. And that'll be it.
Perfect. Well, thank you, Christina, and welcome everyone to the webinar. We're excited to learn about all of the benefits of the Jessner peel today. So before I pull up the PowerPoint real quick, I wanted to talk about something personally as an esthetician I've experienced with chemical peels in general. And one thing I have learned over the years is how much one peel can vary in regards to the different types of peels that are on the market, and how each peel that we choose for our clients depends upon the skin type, the skin goals, and the specific acids and what they're doing. And before any training experience, I used to think that all chemical peels were one size fits all. Well, throughout the years of training and learning, that was an absolute misunderstanding and lack of knowledge. So our goal today in this call is to allow you all to understand what the Jessner peel consists of, what skin type it's best for, what to expect, the benefits, and the outcomes. So we're excited to share our PowerPoint with you and get started, and hopefully you all will learn something and benefit from the call. So I'm going to pull up the PowerPoint. I'm going to share that. Okay, can everyone see that? Hopefully. Okay, so let's talk about the Jessner peel solution, because we all need to understand what type of peel we're dealing with. So with the Jessner peel solution, there's going to be 3 different types of acids, equal parts. And it's a combination of alpha hydroxy acid and the beta hydroxy acid, as well as the resorcinol. So what is each acid doing in the Jessner peel solution? We have the salicylic acid, and that specific acid is going to be a BHA, also known as beta hydroxy acid. That is the oil soluble acid. So that's what's going to break away all of the oil in the sebum, and then it sloughs away, or it exfoliates that hardened dead skin cells. The lactic acid, that acid is going to provide internal hydration to the skin, and then the resorcinol, which is a derivative of phenol, that is going to be derived from phenol, and it offers the antiseptic benefits. So Dr. B, do you have any added comments to add to the Jessner peel solution?
I would add that
we see the original formula being, excuse me, those equal 14 parts. You read about in various places a modified Jessner peel, and that's not the same because it doesn't have the resorcinol in it, so you don't get the same effect from it. The second thing I would add, and you mentioned that different peels, the results may vary depending on how you do the peel and that sort of thing. And we've perfected, we think, as much as you can to get exactly the same result each time if you use our protocol in preparing the skin before the peel and then during the peel itself, doing it in a specific way. So those are two things I would mention.
So you mentioned modified Jessner peel solution. So let's make sure the audience understands the difference of the Jessner's peel solution that we're referring to here and we utilize is 3 acids, salicylic, lactic, and resorcinol, and it's 14% each acid. The modified Jessner's is going to be the salicylic acid, lactic, and in place of the resorcinol, there's TCA, correct, Dr. B?
No, that's not necessarily my understanding of it. I think it's just those 2 acids put together. In other words, it's a weaker peel.
Okay, that makes sense. Good to know. Okay, so going further with the Jessner's peel, let's talk about and understand there's 3 different levels of peels which fall into, we could use a scale of superficial, we could use the terminology middle or medium depth peel, and then deep peels. Well, as we all know, superficial peels would be classified as like a lactic acid. So you're going to have no downtime or very minimal downtime. And then deep peels is going to be like a TCA 30%. There's multiple deep different peels. You're going to have weeks of downtime, even months. Well, the Jessner peel, that's going to fall into the category of medium depth peel, and that's something that we recommend doing once a month. Anything else that we need to add to that, Dr. B, that you can think of as far as understanding the classification of levels of the chemical?
Well, I think, yeah, that's kind of a tricky thing when you think about it. When we talk about peels, the Jessner peel, lactic peel are both superficial peeling agents. They're designed to be used for epidermal problems. In other words, skin conditions that reside in the epidermis. And of course, melanocyte is in the epidermis, so that's a melanin, or the pigmentation is in the non-dermal, the upper epidermal and upper dermal layer sometimes. So if you put 5 layers of Jessners on a condition, you can get down into the in the upper papillary dermal area. And if you're having to go that deep, you should use a stronger peel, I guess is what I would say. You can burn a patient with a Jessner peel. So it's designed for epidermal lesions.
Correct, yes. So we're going to learn the benefits about Jessner's peels. So let's look at understanding the technique of the Jessner peel, and let's talk about as far as this peel, what it's going to treat the best. So we're going to focus on mild to moderate to severe acne. This Jessner solution is going to help sun damaged skin. It's also going to provide treatment for skin discoloration, uneven skin tone. So think hyperpigmentation, which is dark spots on the skin, the sun damage, and it's also going to help with skin texture, overall skin texture. The other important fact that we need to talk about is the Jessner's peel is safe for all skin types. So you can perform this on all skin types, and later on in the call, we're going to talk about how to prep the skin so that you get the most effective, even result of the chemical peel. So the beautiful thing about the Jessner peel is that you can get predictable results, because what are we going to do? We're trained to prep the client for the chemical peel. We're going to be able to provide shortened downtime because we're going to learn how to prep the client for the peel. Therefore, we're going to follow with fewer problems. And of course, it's profitable to the clinic because the amount of investment that it takes, the minimal investment that it takes to provide the chemical peel to the client. So anything else that we need to talk about as far as traditional techniques and how it's easier and profitable to the clinic, Dr. B?
No, I think you pretty well covered it. It's always interesting to me that it's so predictable when you're using a Jessner peel. You can look for the early frosting and decide if you need to do another layer or not. So it's not a maybe I should do this, maybe I shouldn't do this. It's very, very easy to become an expert at Jessner peels.
Right, yes. So as far as to get a result, we have to provide a reaction, or rather we can use the term skin injury. So as we can see here, there's different techniques that we can use, resurfacing techniques or tools. You could use the term modalities that we can offer to our clients to provide a result. Well, the beautiful thing here is that we're talking about chemical peels, specifically Jessners, and the fact that Jessner's peel can be used on all skin types. And think when we really hone in and focus on, okay, what skin type is going to be best suited for a Jessner's peel? For just a moment, I'm going to try to paint like a word picture. I visibly see the outer layer. Think of an orange. How the skin of an orange is, it's thicker skin. You can actually see the pores on an orange. Think excessive oil. You're going to visibly see some sun damage, age spots, and it's going to give them a more effective result because of the combination of the acids, the AHA and the BHA with the resorcinol. Therefore, they're actually going to get some sloughing. They're going to be able to respond with a reaction to the skin. Versus if we think about lactic acid, that's going to be more of a superficial peel. That lactic acid is going to hydrate. It's the main mediator in our skin. And it's going to give your skin more of a hydrated, youthful glow. And the results are going to last for about 14 days, 14 to 28 days, where the Jessner's peel, you're going to perform this instead of weekly like a lactic, think once a month. And you're actually going to have a reactive response to the skin. Does that make sense? Anything that we need to clarify or add to that conversation, Dr. B?
I think you got it covered.
Okay, perfect. So as far as, let's talk about the healing process with the chemical peel. So we have different types of modalities that we just saw on the other slide that we can use to treat the skin. So when we're treating the skin with the Jessner's peel, we are utilizing a chemical agent, a combination of different chemical acids to create a response. And the beautiful thing about creating a response to the skin chemically is that it's able to be oil soluble, and also it's going to chemically exfoliate the skin versus mechanical, think like dermaplaning, or another option would be microdermabrasion, right? If we think simplicity. Well, with chemical acids, you're creating that response to the skin versus just like sand where you're sloughing off those dead skin cells, or microderm, you're just removing those dead skin cells mechanically. So when you add chemical to the skin, think a greater response because it's actually affecting growth factors, fibroblasts, collagen, and it's going to give you a greater response to the end result. Does that make sense?
That makes excellent sense. The other significant difference between mechanical exfoliation and a chemical peel is that mechanical, if you were looking at a very magnified picture, if you had a deep wrinkle and you were dermaplaning or mechanically doing something to that skin surface, you may not get to the bottom of that deep wrinkle. Where you put a solution on, it's going to get every cell surface, the bottom of the wrinkle as well as the top of the wrinkle. So you get a more even correction if you're looking at pigmentation for sure.
Exactly. Yes, that's a perfect example. That's why the Jessner's peel is so wonderful for thick skin, oily skin, acne prone, actually seeing visibly discoloration and things that you see on the skin that your client's looking to resolve. So let's talk about Jessner's solution and the peel solution. Do we have to neutralize the Jessner's peel? No, you do not have to neutralize the Jessner's peel. So the beautiful thing about it is it's easier to control because we're going to prep the skin before. We are going to have quicker healing time. You're going to minimize unexpected results because we are going to learn how to prep the skin properly. It's going to be consistent, overall, results, and it's going to be more effective. Again, the benefits of the peel, it's going to help brighten, it's going to provide an even skin tone, it's going to help minimize pores, control sebum, reduce acne lesions. We can go on and on about the benefits of the Jessner's peel. So let's take a look at this client of Dr. B's and reference before and afters, her before and after. This is an amazing result that we got utilizing Jessner's peel. So talk about this client, Dr. B, and tell us.
Well, obviously, she's at that age, a young adult person that's really saddled with the emotional scarring from having a face that's continually broken out with 20 or more pustular acne lesions. And that puts that in like the grade 4 or the most severe grade. Lesions present all the time, to varying degrees of pustular and infection sort of thing. And actually, she had a series of Jessner peels, and these two photos are before her first peel, and then after a series of, I've forgotten if it was 4 or 6, but done several weeks, in a continued period of time, along with the other skincare that occurs in between the peels. So you can get a very nice result. I would add a severe grade 4 acne, like in that first picture, I would put her on an antibiotic. Of course, I'm a physician, I can write prescriptions. Estheticians should have a partner they work with or a clinic that they work with. They could refer patients or at least get an antibiotic if needed. So it's important to control the infection while you're also controlling the process that lets infection occur. But Jessner's is a perfect peel for acne-prone patients.
Yes, perfect. And I love the information that you provided, how it's important to have a medical director's supervision and involved when you're dealing with that level of acne, because there is times where we do have to utilize the physician's overall guidance and response of, hey, this is my client, this is what she's presented with, guide me along and support me. And there's times where antibiotic is needed to get an end result. And the beautiful thing about having the Jessner's peel is when you combine Jessner's peel and then you're prepping the skin with adequate skincare and you add in that antibiotic, I mean, the end result is going to be substantially amazing. So great information. So this client here, mild melasma, we see that she is a 29-year-old, and it looks as if Dr. Beckman has done a series of 6 Jessner peels. He also incorporated 2 times utilizing daily the Enlighten for 3 months, and then also followed up with post-care. So anything that we want to add to this client as far as how you treated, pre and post care, and anything that you added that's not listed on the PowerPoint slide here?
Well, no, this particular lady has that mask of pregnancy is sometimes called. You can see the bat wing cheek below the eyelids, the cheek from the nose going out toward the ear and sparing the perioral or mouth area. And of course, the forehead is also involved. This young lady was a working mother, 29 years old, and she couldn't take off work for several days to allow a deeper peel to have several days of healing time. So we peeled her on Friday afternoons, and she was able to go back to work on Monday morning with no downtime involved. And over a period of 6 weeks, you can see there, peels. I was doing her peels, six Jessner peels a week apart, but I was only using one layer of Jessners. And we can talk about, you can do more layers of Jessner to get a little deeper, but it's kind of like if you were carving a piece of wood, you can use a great big heavy chisel and take big chunks off, or you can use a very fine penknife and take little layers off. So that's what we were doing. And this was actually about 15 years ago when we did her. So a lot of the tools available to estheticians today weren't even available then. So just proves again how much of a workhorse a Jessner peel can be.
Right. Good to know. So as far as understanding the Jessner's peel, and we talked about how it's going to fall in between, it's going to be a little bit stronger than the lactic acid peel. And you can control, as we just learned, Dr. Beckman referenced the fact that on the client before, that we looked at her before and afters, he did one layer, so that's one pass every week for 6 weeks. And the analogy that he used of, do we want to carve off a lot at a time or a little at a time, and understanding where that pigment lies within the skin. So again, think of the Jessner's peel as where it lies within the strength of different chemical peels. You have superficial, then you're going to have Jessner's peel, then you're going to have really deep peels. And that's when we have the layer of the skin here for you all to see, to understand that more. Next, let's talk about conditioning the skin before we start the peel. So we have to understand why this is so important for every single client, is preparing that skin. Because especially if you see that she's a candidate for a Jessner's peel. So again, what are we looking for? When your client presents to you on their skin, we're looking for large pores, excessive sebum. You're going to see visibly uneven skin tone, brown spots, fine lines. We see that she needs some type of reaction to get a result, okay? But what if she comes to you and she tells you, okay, I'm using over-the-counter cleanser, I'm using a certain, moisturizer, and you look at her skin and you might ask her, hey, how does your skin respond? And she's like, well, anytime I put anything on my skin, it burns. It's very sensitive. Okay, well, perfect. So that's an opportunity for you to explain to her, well, you're a candidate for a Jessner's peel. That's going to give you the best result. But before I actually take you back and we perform that peel, we believe in prepping the skin and creating a healthy environment before we stimulate the skin. So then you would encourage her to start on the TheraDerm Prepare system. And the reason that we do that, and if she asks you or he asks you why, you're going to say, because the main thing is we want you to have the best end result. And the best end result is obtained before a peel by doing 2 things. It's multiple things, but you guys, I want you to remember 2 things. And that's controlling the oil, so the sebum that's on our skin, and then making sure the skin is evenly hydrated, okay? Because excessive oil on the skin is going to cause the skin to be reactive. It's almost like the skin is in it's in like a defensive mode. And so that's when you put any product on your skin, it burns or it stings. Well, when your skin is producing excessive oil, that means that it's telling your glycosaminoglycans, which is our internal hydration, hey, like, we don't need to hydrate your skin. We get to calm down and we get to go to sleep because all the oil is taken over. So the beauty of that is we, of course, have to utilize the cleansing wash to cleanse off all of the debris. But the main important factor in prepping the skin before a peel is using the fruit acid exfoliant, because that's what's going to help control the oil, that sebum production. And it's also going to help slough off any dead skin. Therefore, what does lactic acid do? You all have learned that it hydrates the skin. So that's going to provide hydration. Well, we want to prep the skin with the Enlighten because we want to provide overall even skin tone. That's another huge result, right? Well, then we've got to repair, we've got to fight for radical damage and balance out the overall inflammation and fix all of those free radicals. And then, of course, we have to provide the renewing and the hydration, which is the Uterinox peptide cream, because you've all learned that overall hydration is so important before you perform the Jessner's peel to give them overall result. So now let's talk about the Jessner's peel protocol. So when you're in your treatment room and you're performing the Jessner's peel, the first step that we're going to do is we're going to use the new Peel Natural enzyme, okay? And so you apply this on the skin first. Yes, even if they have SPF on, even if there's makeup on the skin, it's literally the first step. Apply a thin layer, leave it on for 1 to 2 minutes, massage it in. It's going to ball up like a gamache, and then you're going to remove it, and then you're going to apply the cleansing wash, fruit acid, because we want to degrease the skin. The lactic acid is going to hydrate the skin, and then you perform the Jessner's peel. Now, when you go to do the Jessner's peel, you're going to apply 1 layer evenly all over the skin with a 2x2, 4x4, however you want to apply it with the gauze all over evenly. Now, remember, we do not have to neutralize the Jessner's. So what you're going to do is you're going to apply 1 layer evenly. After you apply that layer, and Dr. B, you speak up during this process of protocol, you're going to wait 1 to 2 minutes after the first layer. And we're going to observe for hot spots. We're going to observe for frosting. And we're also going to ask the client on a scale from 1 to 10, 10 being my face is super hot and uncomfortable, remove it or stop. And after 1 layer, if your client is doing well, there's no excessive hot spots in one place, her pain tolerance is 2 to 3, 4, then you can go ahead and apply another layer. Now, talking about frosting, and I want you all, Dr. Beckman, help me with this because I want to make sure everything that I'm saying is clinically correct. So we have when we do chemical peels, we have what's called a true frost and a false frost, okay? And so when you perform a chemical peel and you perform that first layer and you see that the whitening, it's like an overall halo look to the skin. If you take a clean gauze and you wipe off the frost that you see on the skin and it wipes off, that's considered a false frost. And that means that that's just the outer layer of the skin, so that client's not going to get any physical sheet peeling from that. Is that correct, Dr. B? Have you ever used that?
Well, I've not used that particular terminology, but frosting is really the occurrence of hydration in dry, dead superficial cells. So you get a whitening effect, like if a person is in the swimming pool for 2 hours and looks at their hands, you'll see white. And that's because that thick skin in the palm of your hand absorbs water and makes that white color. It's not really truly white like a dye would be or a paint would be, but it's a reflection of a white color because of the hydration in those cells. And when you get a deep enough layer that it doesn't wipe off with a cloth, then you're down to the level that you want to be with your peel agent.
Yes, that's exactly my point. Is the false frost is where you wipe it off with a dry gauze, a clean gauze, and it removes, it comes off, that frost is removed. But then when you go to wipe it with a gauze and it does not come off, then that tells you that you're going to actually have peeling. You're going to have a response to the skin. So as you communicate with your client and you've prepped her accordingly, then at that time, your variables are going to be pain tolerance, hot spots, and frosting. And if you wipe that first layer of that Jessner's, the frost, and it is removed, then that tells you if she wants a response, then I would go ahead and apply the second layer of the Jessner solution. You're going to wait again for another 1 to 2 minutes and then perform your same frost test that you've just learned. And then if so be it, then you can apply a third layer. So typically with Jessners, we're going to be focusing on providing 2 to 3 layers to actually give that client that end result that they're looking for. So after you perform that peel, again, you don't have to neutralize it. So what do? We encourage you to apply a cold towel. Okay, so you can apply and do a cold compress with a towel. Then, excuse me, and then after you do the towel, then we're going to take Eternox peptide cream, and we're going to, instead of like massaging and stimulating it into the skin, we're going to press into the skin. And that peptide cream is going to calm, cool, soothe the skin and stop that burn immediately. So then once we finish, then we're going to put the peptide cream on. Then we're going to, of course, put the Platinum Protection SPF to protect the client's skin. And then we do not want them to wash the skin, touch the skin, or do anything. We need them to leave that on for 6 to 8 hours to get that end result. So anything we need to add to the protocol, Dr. Beckman, that you recommend that we add, change, take away?
No, I think we've pretty well covered it. There will be minor differences from time to time, but these are the fundamental points in the protocol.
Okay, perfect. So as far as neutralizing, I want to touch base real quick to make sure that after the audience understands that after Jessners, talk about what we do. And let's say worst case scenario, you're doing this peel and the client all of a sudden is telling you, get this off my face, it's hot, it's burning. Tell us what we do in that help me in that moment.
When that might occur, as you described, a very sensitive skin patient, and you've done a Jessner peel, say you're on your second layer and it's still burning. Burning is a sensation that only that person can describe on that scale of 1 to 10. But whatever the discomfort problem is, adding a Eternox to the skin at that time instantly stops that painful or unwanted reaction to skin, that heat reaction. So Eternox should be handy. I would mention another thing, that when you put your peel solution on your gauze, don't have it where it drips. You don't want to get a drop of peel solution in an eye. If you did get a drop in the eye, you should instantly put some sodium bicarbonate solution in the eye to neutralize as best you can. So always have some sodium bicarbonate solution within hand's reach.
Very, very important. So let's make sure we understand after we do the Jessner's peel, we have here on the protocol cold water after the Jessner's peel. Does that cold water, does that need to be a cold towel, or does it actually need to be cold water on a gauze? Let's clarify that.
It can be either way. I like to use a washcloth, which is outside. If you fold it in half, the standard, 1 foot, 12-inch square washcloth, fold it in half, and you have a bowl of cool water. It doesn't have to be ice water, but as cool as comes out of the faucet usually works. Wet that cloth, squeeze it a little bit, but just place it on the skin surface. And that wetness instantly cools the skin when it's touching, as opposed to a fan or just blowing cool air.
Again, having the Eternox peptide cream readily available, because I can speak personally to this because, yes, I've had this peel and I know exactly how it feels. And for those of you who have never had a Jessner's peel versus like a lactic peel or our Theraderm Frost peel, the Jessner's peel, it's funny, it kind of creeps up on you. So when you apply it, you don't really feel that sensation initially. It takes it about 60 seconds. And it slowly gets hotter. And to me, and then Dr. Beckman and Darla, you guys all chime in, but it feels almost like jalapenos or like fire ants on my face. Whereas the lactic feels more itchy. It's a different sensation. And of course, being an esthetician, I love being able to feel that response that my skin's having because I know I'm going to have an amazing result. So that's something else about the Jessners I noticed years ago when I first had one is it feels completely different. So maybe having that conversation with your client before you do it so they understand that as time goes on, that heat index is going to increase so they, don't all of a sudden panic. So having that open communication with them of explaining if they've had a lactic from you before versus the Jessners would be really good for you to do. So anything else that we need to add about the heat index or anything like that? I think we've covered it all.
Well, I think there may be another slide further down that has to do with the heating and cooling of skin. But I would say you don't put the next layer of Jessners on until that heat has dissipated, gone back down to baseline level or very close to baseline level. So that's another indication to use.
Yes, very important. And I have the slide pulled up. Hopefully you all can see it. It's peel monitoring. And then, so last but not least, let's talk about post-peel care. So it's very important to remember as far as after you perform the Jessner's peel, encourage your client, do not wash, touch, or do anything to their skin or to their face for 6 to 8 hours because we want them to get the maximum end result. And then, of course, if you do it, let's say that you do it today on a Wednesday, well, then they're not going to wash or start their post-care until Thursday morning. And so with that being said, the Prolong system is going to provide all their needs for 2 weeks. And the first step that they're going to do that next morning is they're going to utilize the new peel, and then they're going to cleanse, and then they're going to provide, they're going to apply the fruit acid exfoliant, the skin brightener, which is the Enlighten, the OPC, and of course the peptide cream. Now, the other thing to make sure is that your client understands with the Jessner's peel, they're actually going to start seeing that result, or that rather, the better term is the response on day 3. And on day 3, they're going to notice, they're going to have flakiness. So initially their skin will feel like a mild sunburn, and then it'll get tight, and then it might feel a little rough because that's all of the dead skin cells that are making their way to the surface. And then on day 3, they're actually going to notice sheet peeling and flakiness on the skin. The goal is by day 7, possibly day 10, all of the dead skin, the flakiness, and all of that subsided and their skin is back to normal. The other important fact for post-care is we need to remind our clients that out of everything, they have to apply SPF, of course, and then they need to avoid excessive temperatures, heat. So we don't encourage sweating, so exercising where you're going to be sweating a lot, hot tubs, saunas for at least 48 hours post-peel. So anything else that we need to emphasize on post-care, any tips, tricks, advice?
Well, as you had mentioned, at some time, and it's different in different age and skin types, but at some time post-Jessner peel, you're going to see flaking or that roughness of skin. I call it fish scales. And the earliest sign of those fish scales may be at 24 to 48 hours. That's still okay to use new peel to put it on and leave it for a minute and just gently rub, and that will smooth that skin surface. I don't mind after 24 hours if a patient uses a mineral powder makeup. You can't cover red or pink with traditional makeup, and you can't cover fish scales with any kind of makeup. But if you can get smooth skin, the mineral powder will then cover any redness. So you can go to work on Monday if you had a Jessner peel on Friday.
Good to know. Very good information. Well, perfect. So at this time, this concludes our Jessner's peel webinar. I'm going to let Darla take over and conclude and add anything that we need to learn and finish up the webinar. So thank you.
Okay, Bree, I have a couple of questions that we need to answer. One lady was wanting you to clarify, Do you wait 1 to 2 minutes between layers or wait until the heat subsides, which could be longer? You know, when you're doing the layers of Jessners?
Yes. So on the slide, and then Dr. B also reminded us that we wait until the heat subsides. So you want to use those two clinical endpoints. So typically it's going to take you 1 to 2 minutes before the heat subsides. But the main one that you want to always follow, like Dr. Beckman reminded us, is waiting till that heat subsides. Correct, Dr. B?
Yeah, your skin temperature or the feeling of temperature in a peel that's going on is not going to get exactly to pre-peel baseline, but it's going to get very close. On a scale of 1 to 10, it may get down to a 1 or a 2.
Right.
At the height of the peel action per layer, it may get up to an 8, maybe even a 10, cause some tears in the eyes. But it will go back down on its own, and when it levels out at that lowest level, it's going to get to probably a 2 or somewhere in that level. Then you can go ahead and do the next peel layer.
Mm-hmm. Perfect.
All right. Another question I have, are you able to spot treat Fitzpatrick 4 to 6 hyperpigmentation with Jessners?
I have in the past. It's better to go ahead and treat the whole skin surface the first 2 or 3 peels that you do, then look and see if you need to do additional work in selected areas.
Yes, I agree. And speaking from our scope of practice as a licensed esthetician, I always, teach and train on the side of caution and focus and remember what we're licensed to do. And instead of spot treating, I leave that up to the professionals and the doctors. And for me, I always focus on the whole entire canvas of the face. So, instead of just spot treating with Jessners, on the left cheek, just go ahead and do the whole entire skin and prep their face. If you're working with a medical director or your MD is on site, then that's when he would come in and I would give him the TCA or whatever peel or Jessners that you're performing and say, here, doc, you spot treat. That's my advice as a licensed esthetician.
Well, a modification of that could be, you say you're doing a Jessner peel and there's an area that's a quarter size that's hyperpigmented. I would put a layer of Jessner, whole face, and I may go back and put a second layer on just that spot. So we're not selectively treating only the spot. Treat the whole face at least with 1 or 2 layers.
Yes, I love that modification. That's perfect. Yes, very helpful.
Okay, another question I have, and this is still like a Fitzpatrick 4 to 6 patient. Is it best to use Jessners for hyperpigmentation 7 to 10 days apart for 3 consecutive visits? So
in a 4 to 6 or 4 and above Fitzpatrick, I would rather wait 2, maybe 3 weeks in between just to see how they're going to respond. Because those are in that area, you can get hyperpigmentation in a Fitzpatrick 4 if you peel too deeply the first time.
okay.
And the other thing to add to that is when you tap into the Fitzpatrick 4 through 6, I can express enough, and it's with all skin types. But the more that we take the fact of prepping the skin before, a procedure, that is vital to what you do. So make sure that you're prepping that skin before you perform anything, no matter what color, what tone, what skin type, because that's just going to give you more safer end results and overall even results.
I agree.
Okay, another question, and Bree, this is probably for you, and it's going to kind of also pertain, I mean, you can kind of tell what you charge, but, this is also going to vary according to where you're located. One was wanting to know, what do we normally charge for a Jessner's peel?
I mean, great question. And really, when I get that question, I always say it depends on the area that you're in. I always encourage you to look online or call, 5 to 8 different clinics around in your area. As far as what we charge $149. But again, it just depends on, what area that you're in. And also the years of experience you've had. I mean, there's several different variables, but I always encourage staying within 149 to like 249. It's a huge ballpark, but that's my advice. What are your thoughts?
And is that also, I mean, if they were just doing a Jessner's peel, does that matter? Do you keep it at that price whether you do 1 layer or you might do 4 layers? Do you charge them more, or is it a set standard?
I suggest setting a set standard. And so when you have your clinic menu, is whatever price that you have on your website or your clinic menu, that's going to be considered your anchor price. So make sure whatever you set your anchor price at, that you're setting it high enough so that maybe in peel season, which we're in now, so let's say it's on your menu at $175, and you're setting it high enough so that if you say this month in October, let's have a special for $149, or maybe it's buy one get one free, or maybe the other thing that's really popular with chemical peels is packages. So buy a package of 4 and you get 20% off. So always have your anchor price high enough so that when you do offer a series, that you can take 20% off and you're still covering your overhead and you're being respected and valued for your time and your service.
I would suggest that not modify your charge for the peel itself. If you think in terms of a surgeon doing an appendectomy, what does he charge this patient and that patient? It's the same price for an appendectomy. One may take an hour, one may take 2 hours. It'll even out in the long run. So keep your peel charge the same. And then you can add discounts or specials or other things with it.
Are you talking about Darla's question of how if the client needs 1 layer or 3 layers, don't change the price? Is
Right.
That what you're? Yes.
Right.
Yes, we don't, because it's almost like you tap into the thought process, or at least I do. It's not the client's fault that they need. It's like if Sarah needs 3 layers and Joe needs 4, it should still be the same price. That's the whole concept. Yes. So whatever your anchor price is, it's the same for everything, whether it's 1 layer or 4. And
Right.
set it high enough so that you can have specials and sell it in a series. Perfect.
Also, if you add, say, like a dermaplane to your Jessners, they need to add on for that. They don't.
Correct.
It's an add-on service.
Yes, correct.
Okay.
So you would charge an upcharge to adding the dermaplane to the Jessners. You could also even, I've seen, some estheticians and nurses where they actually have on their menu, they specifically say dermaplane plus Jessner's peel, and they have a price. But then they can also have where dermaplane is an add-on, and then just the Jessner's peel might be a little bit cheaper. So you're giving your client 3 options. And not that this call is about marketing or business, but when you do offer your client 3 choices, science tells us that they're always going to choose the middle option. So what I mean by that is we're talking Jessner's peel by itself, we're talking dermaplane add-on, and we're talking Jessner's peel and dermaplane as a price. So what that client is always going to choose, because it's the middle price, because they're like, man, I don't want to get just the dermaplane. I need a chemical peel, but I don't want to pay for the dermaplane and the Jessners. They're going to get the Jessners, and what's going to happen is they're going to add on that dermaplane, and you're going to make more money. So anyways, I mean, I'm kind of getting off on business and marketing, but as you can see, it excites me. So I hope that helps.
Okay. I think that's all the questions that I'm seeing. Next week, we're going to be back on Wednesday at noon, and our topic is going to be, we're going to go more with acne patients and the process of using new peel and how to treat some acne patients, since we're kind of getting into the school and the football players and and acne on backs and stuff. So we will have that next week. And that's all I have.
I think that's it. I think we're done here. We'll wrap it up. And for those of you who weren't able to jump on, we will send a replay video. And for those of you asking, we will attach the PowerPoint slides, so you'll also have those to reference as you watch it, or if you don't want to watch it and you just want to have the PowerPoint slides. So anyway, that is it. So thank you so much, and we will see you next week.
Thank you. Bye.
Goodbye.